It's no secret that as we age physically, so do our brains. And many older patients and family members report memory loss, which is due to normal cognitive function, which can lead to dementia, though. And most people automatically associate memory loss with dementia, but it's not always the case. So in our first Real Health Medicine cabinet, we found a product that can assist in boosting cognitive fitness and longevity. But first, we have naturopathic Dr. Rory Jean-Jacques to chat to us about the symptoms of dementia and how we can support cognitive function in adults. So I've heard that dementia has actually been referred to as type 3 diabetes.
That would make a whole lot of sense because of all the research that they've done with refined carbohydrates and sugar and the damage that it does to your neurons. You know, to a large extent, they're looking at the changes in our diet and our lifestyle, how our diet and lifestyle, how there's a pandemic increase in dementia and memory problems, but at the same time, it was the advent of the industrial age and the increase in refining carbohydrates. It's also a big factor to do with it is highly processed and heated vegetable oils. So this whole low-fat diet was a big issue because we never got enough of the right fats, particularly saturated fats, coconut, avocado, omegas, and things like that. And with that high amount of carbohydrates, they spike the blood sugar and they create various types of things which damage the neurons and create various effects with neurological degeneration. And you can even just start having memory loss when you're quite young. And that can be because of gut, nutritional deficiencies and things like that. But over 65 is when we start looking at really defining it. Dementia is more an explanation for a range of cognitive impairments. And probably the main form of dementia is Alzheimer's. There's also a form of dementia called vascular dementia, and there are other sort of rarer ones, but those 80% of the dementias are Alzheimer's in nature. There's a type of plaque in the brain which interferes with the neurons called beta amyloid plaque, and they're trying to find the root causes. You know, natural medicine looks at it one way, modern medicine, you know, allopathic medicine looks at it another way. But there's so many things in terms of diet, lifestyle, and even genetics that influence how we develop and how our neurons age and how we can age.
And mitochondrial function as well.
100%. Your brain consumes 80% of your energy. So mitochondrial nutrients like alpha lipoic acid and other types of things, certain nutrients, B vitamins and things, play a major factor in cognitive function.
When is it cause for concern? Because the problem with Alzheimer's is once it's diagnosed, it's too late, right? Now you're trying to do the best you can with a bad situation, but there's a lot that one could have done to prevent getting to that. I mean, we can talk about genetics and things like that, but from when does cognitive decline and neurodegenerative conditions, when do they become a cause for concern and prior to it becoming Alzheimer's?
So there's so many things that we can do in terms of our lifestyle to prevent that. My grandfather died of dementia, so it's something that's very, very close to me, and I understand it. I have a particular interest in it, and I work with a lot of patients with it. It's in terms of preventative, there are amazing things that we can do. We can add in turmeric, coconut oil. We can avoid foods or medicines very high in aluminium. They've done major amounts of research linking aluminium and aluminium deposits in the brain with Alzheimer's and things like that. And it's quite interesting that the Indian population in India have the lowest incidence of Alzheimer's in the world because they consume very, very high amounts of various spices that
like coriander,
turmeric, and various things that chelate those types of heavy metals out. Modern day pandemic is a type of pesticide called glyphosate that they spray on all our food, and what that does is it makes us uptake aluminium at an absolutely insane rate. And aluminium is everything. It's in our water supply, it's in our deodorants, it's in our toothpastes, it's in antacids, it's in all our foods as a flow agent. When I do mineral analysis on my patients, majority of people have the highest aluminium. And in patients that are ADD or much senior patients, we see mercury, cadmium, and aluminium off the charts. So we start looking at those and we start seeing it as a causative factor. Maybe not the sole factor, but a causative factor.
And there's that accumulative effect. But when is it an issue, say, I'm a little bit dehydrated, haven't been eating well, and forgetting things, to, okay, I think we have a serious problem here and we need to look at some major interventions from a dietary perspective, from a lifestyle perspective as well? Because these are things we should be doing anyway, right?
We really should be as part of a healthy lifestyle. But the thing is, if in senior patients, sort of 65 plus, when you start to see issues, where did I leave my wallet?
Yeah.
Cognitive issues, reasoning, judgment, coordination, frustration, anger, mood changes, apathy, listlessness, not quite there, spacing out, those types of cognitive changes that you see were small little issues but are starting to become more of a challenge and starting to progress, because dementia is it's a progressive neurological degeneration. So what can you then do to change that? So exercise can be something that you can do. There are some food and dietary changes that can happen, and there are some key supplements where they've got a lot of research that does help. And I've seen with a lot of my patients, they have improved lucidity and ability to talk, and their children say, look, we've noticed great improvements, and sometimes so significant. There's another form of dementia, which is a vascular dementia, which can be caused by a lack of circulation, because if you've got inflammation in your arteries because of heart disease or high blood pressure or high cholesterol, things like that, you start to get the blockage in the arteries, so you don't get the circulation, so you're not getting oxygenation. So any products that can improve that circulation, beetroot juice, beetroot and that type of stuff, dilates the blood vessels because it supports nitric oxide. So they've done a lot of research with that for improvements in improving cognitive function.
And even just deep breathing. Some people go throughout the day with just shallow breathing. They never stop, and take a few deep breaths in. We're stressed, so you're constantly in that fight or flight mode as well.
Exactly.
So that leads to other lifestyle factors, reducing stress and therefore reducing inflammation and inflammation throughout the body as well.
Absolutely. So stress and hypoxia, so very, very low breathing, they've actually looked at the brains of people like that, and their brain function hardly even functions. Where people breathe rhythmically with your heart rate, and deep breaths where you start to balance out your CO2 levels, all of a sudden your cognitive function improves. So stress can create neurodegeneration.
Besides sort of your more mature patient, in 65 plus, are there any people that are more susceptible or at risk of developing dementia? Is there a strong genetic link?
So they've been doing major research to try and find out, and they're really struggling to find out what the cause is. And genetics can play a factor, and it can skip certain generations. But as we understand about various forms of epigenetics, how your lifestyle is and what you switch on with certain genes, on what you eat, you can really live a very, very healtty life.
We can't blame our genes as much as we would like to think.
And which genes are those? The Levi genes.
Yeah, exactly. High-waisted genes, which are in fashion. So this is the thing, is that we're also starting to see research come through that ketogenic diets are particularly 100%. Helpful for people that are worried about cognitive decline or have already started experiencing the onset of cognitive decline.
100%. So high-fat diets and fat consumption makes them, and even intermittent fasting. I mean, if you looked at us as mammals that would have evolved during the Neanderthal days, we wouldn't eat for extended periods of time. The body goes into a fasting, regenerative state. So the way we eat and what we eat and how we eat it is very, very important. So they've done a lot of research with ketogenic diets for the preventative component and even for improving on a basic treatment basis.
Just talk to us about fat and the brain and why the brain needs fat. Good fat.
So after water, your brain is practically 80% fat. The body loves to run on coconut oil, which is a medium chain triglyceride. It bypasses the liver, goes straight into the system. And they've done a lot of research where they would just give people a teaspoon of coconut oil with massive improvements. Fish oils, they've done massive, probably the most research across the world. I prefer the saturated-based fats because I find really good improvements with my patients.
And so now we're talking about Clarity by NeoGenesis Health. Clarify rather, for mental clarity, cognition, and memory. What sets this product apart? What are the hero ingredients?
So there are 3 ingredients in there. The one is called artichoke leaf extract.
Okay.
Not a lot of people know artichoke, which is really good for the liver. Now, in Chinese medicine, a clean liver and a healthy liver equals a clear mind, because you're clearing all those endotoxins and those byproducts which can interfere with cognitive function. But they've done amazing research around artichoke as a nootropic. Now, a nootropic is something that enhances cognitive function. So they've done research that it lowers inflammation in the brain, and it actually shows how the dendrites, which are specific neurons, actually increase the growth of new neurons and the firing and communication between them.
Amazing.
So that's fascinating. It's got something in there called vinca, or vinca minor, the lesser rosy periwinkle, which has an active ingredient in it called vinpocentin, and that has done major research all over Europe for improved blood circulation to the head area to increase the turnover of energy in the brain cells. It's also been shown to improve the increase in dopamine and serotonin and cognitive, which are very, very involved in brain energy metabolism. And then there's passion flower. Passion flower also extremely good for circulation, but it's an anxiolytic without making you tired. So, and that lowers anxiety levels, so it's very, very calming. So people that have cognitive issues, especially senior, they need something that will lower inflammation, improve blood supply, but they also can get very anxious and very disorientated and not sure where they are. And we've had phenomenal results with our stroke patients.
Just nice and calming and
calming, improved. They just say, listen, I'm starting to remember. I'm getting the clarity. I'm feeling much, much better. Even for adult ADD, or, adults, we're always looking for that optimal performance. Our brains are overstressed. We want to calm those brain waves. We want to energize, and we want to make sure that our neurons are communicating in the right way.
Say for children?
Phenomenal results in children. A lot of kids have been, a lot of moms have been using it as an alternative to a lot of the prescription-based stuff without any of the side effects.
And could you use it in conjunction with prescription-based?
Can be using, especially if they're not quite getting the results. Can be used concomitantly without any negative side effects. It's something that I've seen in practice and feedback that I've got from a lot of practitioners. Very, very, very good results. And that's what it all comes down to, is results.
Before I let you go, where is it available?
So it's available at independent health shops, pharmacies, and on the website neogenhealth.com.